So there's very strong evidence that our thoughts, our emotions and our behaviours influence pain. And we have a health system that scans people, tells them that they're damaged based on the scan, gives them advice to protect the back and guard it, avoid the things that might be painful, and that often leads people down this process of becoming frightened, distressed, and despairing that they have no way out of this cycle.
Since I've been doing this treatment, I've started getting my life back. I've started walking on the beach on the sand, which is something I avoided for so long. My child loves nippers, and I'm now on the beach going up and down the sand with her. I'm pushing a shopping trolley around the store. I might be doing it more mindfully, but I just have that inner courage now to try new things. I went walking on a reef the other day and looked for octopuses with my kids. I'm starting to plug back into life, and it feels great. It's definitely had lots of positive impacts on other facets in my life. It's helped my mood. I'm not bogged down with that pain and exhaustion all the time. My kids are benefiting from not having a grumpy, tired mum all the time. I'm not brain fogged from being on neuropathic medication and pain medication. It was like I was living underwater. I was brain fogged and slow and irritable. I'm not any of those things anymore. I'm far more engaged with my children, and I'm far more engaged at my work and with my friends. I'm not cancelling on them, I'm not leaving early. I'm like, what are we going to do next? I'm definitely pushing the boundaries of what Sam used to be able to do and would consider doing. And that's really exciting. I'm fulfilling life stuff again, which is great.
An important learning from our study was that it took quite a lot of training for the physiotherapist to develop the new skills and confidence required to competently deliver the intervention at a high standard. And this was despite the fact that some of the physios were already quite experienced. The training included practice on real patients and receiving feedback from experienced trainers based on a competency checklist. The physiotherapists described this as one of the critical elements of their training. For clinicians who've not had the opportunity to undertake this training, there are some key elements of CFT that can be applied immediately and reflect what's currently recommended in best practice guidelines. Firstly, it's important to identify and then target a range of physical, psychological and social factors that are contributing to an individual's pain and associated disability. Secondly, CFT is a person-centred approach and focuses on improving functional activities that are most important to an individual. Finally, in CFT, clinicians take on the role of a coach, guiding people to self-manage and take control of their own condition.
In this clinical trial, cognitive functional therapy was delivered by specially trained physiotherapists. Probably, it can also be delivered by clinicians with different professional backgrounds. This will require training to develop greater knowledge and different skills to care for people with chronic low back pain. Chronic low back pain is one of the most challenging conditions to manage because we generally do not have good treatments. That's one reason why the burden keeps rising. Health systems everywhere fund many tests and treatments known to be of little benefit to patients, and some are even harmful. Healthcare administrators now need to shift funding away from ineffective treatments towards interventions that comprehensively address people's pain and disability, such as cognitive functional therapy that has now been shown to result in large clinical benefit for patients, as well as substantial savings for society.
So the RESTORE trial gives hope to people with chronic low back pain. It gives hope that there is a change in narrative around pain. Instead of scanning people, identifying what's on a scan and telling them they're damaged and setting rules around pain, to give people a new understanding of pain, to give them a new approach in terms of the role of the practitioner or the clinician as a coach rather than as a treater. It empowers them to self-care for their own back and to have confidence to manage their own pain, to re-engage with life again.
On behalf of the trial team, I sincerely thank the patients, the clinicians and the funders, without whom this trial would not have been possible.